Now, when we prepared for this interview, you mentioned something very important around different perspectives. So as healthcare professionals, we focus a lot on doing things to reduce hospitalisation for heart failure and reduce the risk of death, which are obviously very important. But quality of life for people is very important too. So would you like to perhaps just either say to healthcare professionals or other people living with heart failure, how perspectives over priorities can change throughout the condition, and perhaps how we as healthcare professionals can broaden our main aims when we develop research or guidance?
I think that's really important. So, yes, what I found early on was, so I was 50 at the time of my diagnosis, so not necessarily the typical age for a heart failure patient, which is nearly 80 years old. And I was given particular drugs which had effects on me, which I didn't particularly like. And after a while, I actually had quite a direct conversation with my cardiologist where I said, I actually want quality of life, not quantity of life. And I found that these drugs were stopping me doing things. For example, at one point I could only walk about 20, 30 meters before I had to stop and lean on a wall just to be able to breathe properly. And I said to him, I would rather die riding my bicycle than die 20 years older, sitting in an armchair. So really this summarizes for me that it's actually quality of life is more important to many patients. Now, I think that's a dynamic thing. So it might be particular to a certain age. So at 50, I was interested in the quality of life which allowed me to ride a bicycle. Maybe at 80, if I'm still alive, quality of life might be to stand in a goal and kick a ball to a grandchild or roll on the floor with a child. And so actually I might accept some compromise in what I can and can't do just so that I can do those activities. So yes, you're right. While when I talk to doctors and nurses less so, but when I talk to doctors, it is about, do people live or die? Can we go for longevity? Whereas actually for me, a lot of it is around quality of life and the things that you can do in your lives. And from my conversations with other patients, particularly on the ESC Phaeton Forum, quality of life actually is right up there in terms of what they look for.
Thanks for sharing that. So it not only helps us from our perspective as healthcare professionals, but even for other people to know that it's okay to raise those questions to your healthcare professional. Sometimes it's not a comfortable environment to maybe feel like you're questioning the doctor or the nurse, but actually these are the kind of conversations we want to have with people, so that not just improving longevity, like you say, but the quality of life a person has. So thank you so much for sharing that. If you've been watching and you've got any questions about heart failure, treatments, medications, or how to live with it, more information can be found on this website, www.heartfailurematters.org.